How do Hindu festivals and fasting practices impact healthcare planning? Hindu festivals and fasting practices have significant implications for healthcare planning, both for individuals and healthcare providers. Understanding the timing, dietary restrictions, and specific rituals associated with these practices can help ensure that healthcare is delivered in a way that respects patients' religious and cultural needs. Here are some of the ways Hindu festivals and fasting practices impact healthcare planning. Awareness of festival dates and practices. Healthcare providers need to be aware of the major Hindu festivals, as these can affect patients' availability for appointments, surgeries, or treatments. For example, patients may prefer not to schedule medical procedures during festivals like Diwali or Navratri out of a desire to participate fully in religious and family activities. Understanding the specific practices associated with each festival, such as fasting, special diets, or night-long vigils, allows healthcare providers to offer relevant advice and accommodations for their patients. Fasting practices. Many Hindus observe fasts during certain festivals or on specific days of the week, dedicating themselves to prayer and abstaining from food or water for varying periods. Healthcare providers should inquire about patients' fasting practices to adjust medication schedules, nutritional advice, or treatment plans accordingly. Fasting can impact patients' physical health, particularly for those with chronic conditions such as diabetes, where skipping meals may lead to hypoglycemia. Tailored advice and monitoring are essential for fasting patients with health conditions. Dietary restrictions. Hindu festivals often involve specific dietary practices, such as consuming only vegetarian food or avoiding certain types of grains. Healthcare providers should consider these dietary restrictions when recommending diets to patients or providing meals in healthcare settings. Nutritionists and dietitians can work with patients to ensure that their nutritional needs are met during periods of fasting or dietary restrictions, offering alternative sources of essential nutrients that comply with religious practices. Mental and emotional health. Festivals and communal fasting practices play a significant role in social cohesion and emotional well-being, offering a sense of belonging and community support. Healthcare providers should recognize the positive impact of these practices on mental health, especially for patients who may be feeling isolated. Conversely, the inability to participate in these practices due to illness or hospitalization can affect patients' emotional well-being. Healthcare providers can acknowledge these feelings, offering support and, where possible, accommodations that allow for participation in a modified form. Planning and communication. Open communication between healthcare providers and patients about upcoming religious practices and festivals is crucial for effective healthcare planning. This can involve discussing the timing of treatments, potential impacts of fasting, and any concerns patients may have about adhering to religious practices while receiving care. Healthcare facilities can consider creating informational resources or guidelines for staff on the religious and cultural needs of Hindu patients, particularly around times of significant festivals and fasting periods. Conclusion. Hindu festivals and fasting practices significantly impact healthcare planning by necessitating accommodations for dietary restrictions, medication management, and scheduling of medical procedures. Awareness and sensitivity to these practices can enhance patient care, demonstrating respect for cultural and religious beliefs while ensuring that health needs are adequately met. By fostering open communication and offering flexible care options, healthcare providers can support their Hindu patients through important religious observances, contributing to holistic well-being.